Today, we're going to discuss why you're wasting time repeating ADLs in therapy and what to do instead. But first, I'm Nicole, the OT with the Note Ninjas, and together with Stephanie, the PT, we help OTs, PTs, and SLPs with treatment planning and documentation. We're also the creators of the Note Ninjas membership and the pediatric series. So if your therapy session looked like this, you start with brushing your teeth, and then you're doing that again, brushing the teeth, and then again the next day, you're actually not being functional. You're wasting time. And I know that we are all taught that ADL-based treatment is really the gold standard in therapy, and it is when it's done right. But here's what no one tells you. It's that simply repeating that ADL task, doing the brushing the teeth over and over and over again, isn't necessarily skilled therapy. It's just practice, and that's not reimbursable. So to be considered skilled, your treatment has to do one of these three things. Number one, address a barrier to task performance. 2, use a preparatory task to target those underlying impairments. And 3, involve cueing, grading, strategy, training that requires clinical skill. So let's say your patient struggles with grooming at the sink because of poor standing balance. Instead of having them brush their teeth for 10 minutes again, you go back and you set up the dynamic reaching task with a mirror feedback. You use tactile cues to improve weight shifting. And you can say maybe grade the activity by adjusting support or dual tasking complexity. That's skilled, that's documentable, and that's going to be able to show progress. Another example is a patient can't bathe due to maybe poor shoulder range of motion. You can prep with dowel lifts, then simulate reaching for shampoo on a shelf. Patient fatigues during dressing, try training energy conservation with clothing sequencing and seated options. Patient loses focus during grooming, try embedding executive functioning strategies and use metacognitive cueing. So when you document, don't just say grooming task completed. Something more skilled would be therapist provided tactile and verbal cues for midline orientation during simulated grooming task at sink to reduce fall risk and improve task completion. So if you're ready to stop second guessing how to make ADLs skilled, you want to grab our treatment guide for ADLs, transfers, and balance below. We'll link it here. It's backed with preparatory strategies, cueing examples, and clear documentation phrases that show your clinical reasoning and protect your license. Therapy should never feel like you're babysitting because that's not skilled, and your time is too valuable to waste repeating tasks without purpose. Let's make every minute matter and make your notes reflect the skill you bring to the table. See you next time.